Hello, my name is Dennis Thompson. I am the developer of the ARPWave system. And what I'd like to talk to you about today is the #1 surgery in all of the world. And we call it joint replacement surgery. So if you've been told you need a new knee, a new hip, a new shoulder, or spinal fusion, you fall into that category of joint replacement surgery. Everyone is told when they're bone on bone, that is the only option they have. I'm here to explain to you there is another option. And that option is our system. And we're so convinced that we can help you that we'll offer the opportunity to prove it to you at absolutely no cost or obligation to you whatsoever. But first off, let's talk about the condition. And let's use the example of a knee. You've been diagnosed with bone on bone in the knee. No question about it. Absolutely no question about it. You are truly bone on bone. But that is not the origin of why you are bone on bone. So when we do an MRI and we do an X-ray, we do an ultrasound, we do any type of therapeutic study or imaging, what we're finding is where the problem ended, not where the problem is coming from. In our system, and we're pioneering a brand new branch of medicine, and this is not alternative medicine. This is a brand new branch of medicine that we call neurological soft tissue medicine. Everyone you've addressed up till the time you met us has addressed your symptoms as physiological symptoms. Pain is a physiological end result of the physiological symptom. It is not where the signal is coming from causing the problem. What we do in neurological soft tissue medicine is we find out where the origin of the problem is, preventing your muscles from doing what they're supposed to do, which is act as a shock absorber. So let's use a simple analogy. Let's say you're an automobile and you decide to take all the shocks off your car. Well, you drive around town for a little bit, and it's a rough ride, but you're not going to do a lot of damage. But then you decide, well, I think I'll drive to Alaska and back. By the time you get back, you're not going to have a car because all the force went directly into the frame of the car, not into the shock absorbers where it was supposed to go. So it's going to cause a lot of damage. At that point, you got two choices. Throw away the car, which most people don't do, or get brand new shocks. Well, your body's the same way. Your muscles are shock absorbers. If they're not neurologically getting the right signal to absorb force, then all that force is going to your frame, meaning your bones. So as an example, in your knee, if all the force consistently keeps coming into your knee, you're wiping away all the fluid, you're wiping away the cartilage, and sooner or later you're bone on bone. What do we do different than everybody else? We don't change the fact you're bone on bone. We change the force going into this area so you don't feel you're bone on bone. You don't have pain. You don't have restricted range of motion. And isn't that why you would have surgery anyway? It's because of the pain and because of the restricted range of motion? Of course it is. So what we're saying to you is there is another way. And that way doesn't require surgery, doesn't require going through months and months of rehab, doesn't require taking tons of medication. It simply is changing the nervous system to fire the muscles correctly so the muscles will absorb the force, keeping the force out of the joint. And we're so convinced we can do that, we're so convinced that we can show you that we offer you that opportunity at absolutely no cost or no obligation. You've got absolutely nothing to lose but the pain you're experiencing right now. And there's only one way you're ever going to know if what I'm saying is true, and that's to give us that opportunity to prove it to you. And if it costs you nothing, what do you got to lose?